Lim,
Good morning.
how are you?
I'm great.
So there's been a story that's been sort of making its way through the news over the last couple of days and weeks, I guess, the last week or so, that there's some polio-like disease or virus or sickness that it's working its way through. It seems to be hitting kids, and it started in Minnesota, but now it's going and being shown in a number of different states. What's going on?
Well, the update came from the CDC, and this is the CDC's job is to monitor things like this. This is a new illness, not known before. It's polio-like. It affects the spinal cord and results in some paralysis, especially the upper extremities. The CDC updated and said 62 confirmed cases this year in the United States. And they've been tracking this since 2014. And then locally, apparently there's one confirmed case in the St. Louis area. There's a lot more cases in Illinois, but they're all in northern Illinois. There's no confirmed cases sort of in Illinois closer to the St. Louis area.
When they say polio-like, what do they mean by that?
It means it's a disease which attacks the neurologic system or the nerves. And so all of a sudden you don't have the ability to use those cables to control the muscles. And so you lose that, and then all of a sudden you can't use your arms.
Is it showing up in kids?
It is showing up in kids. That's part of the diagnostic criteria now, is they think this is a illness that kind of looks at 18-year-old folks or younger. The problem is, and the scary thing is, there's no known cause as of yet. They've tested all of the known cases for actually polio, and turned out that there is no actual polio in any of these. And so the polio vaccine itself still, I think, remains good and true to the test, meaning that polio has basically been eradicated for the most part.
Right.
But this is possibly a complication of another virus. And so common colds are caused by viruses. They're adenoviruses or enteroviruses. Those are their names. Some of those viruses we know from a heart standpoint, more closer to my business, can attack the heart and can cause severe problems from a heart standpoint called myocarditis. It's possible, but not confirmed, that some of these viruses or a certain strain of these viruses might attack the spinal cord and end up with this type of condition. They're putting a lot of resources in it. They've put forward updates for clinicians and hospitals, diagnostic criteria. If you see a case like this, these are the samples we want. And they're running a bunch of tests to try to kind of track down what's causing this.
Is it permanent, or do you regain your motor functions after a while?
Unfortunately, as of right now, it looks like that's permanent.
Really?
The motor functions are not coming back.
When you say polio-like, I know you just said that they didn't test. It tested and it wasn't polio. But there are kids who are not getting the polio vaccine for certain reasons. And we know that some viruses mutate. So any evidence of any of that having to do with this?
Well, I think you'd have to get the concrete, bottom line answer from the CDC. But as far as I can understand from what they said earlier this week, this isn't a polio type virus. And so
it's nothing to do with polio.
It doesn't. The only thing it has to do with polio is that the syndromes and the symptoms have some similarities, but it only affects the upper extremities.
Gotcha.
So that's a little bit different.
Yeah.
Yes, viruses mutate. So certainly the two viruses that I named, the adenovirus and the enterovirus, these are viral strains, and it's highly possible that there's been some mutation along the line that allows them to kind of hone in on the neurologic system in the spinal cord.
I grew up in a world where we didn't worry about polio. Polio wasn't in our consciousness. Was polio, or is it, or was it? Could you catch it from somebody else? Was it like a common cold where you had to stay away from people who had polio?
Well, it was a virus, and the spreading of viruses varies, depends on the particular virus. But there were polio epidemics where it did spread, and there were significant outbreaks where large groups of populations came down with it, and this was pretty devastating. And so the advent of the polio virus was that vaccine for this virus was one of the first to come around as a vaccine to really be proof of concept. Meaning,
Right.
look, we really can take a serious infectious disease, virus, and kind of basically put our shoe on top of it and squash it like a bug. And it really worked. It's phenomenal concept. Proof of concept, and we've been waiting and looking for every time now. How many times you hear, well, maybe there's a vaccine for this condition, or maybe there's a vaccine for that condition. About a decade ago, there's a concept of, oh, we're going to work really hard at a vaccine to come up to treat HIV, and then keep moving forward along other aspects. So that there is a great story in the polio vaccine, and it really has worked. This disease state that we're talking about right now, this is in its infancy. Before you can come up with a vaccine, you have to actually come up with a specific cause.
Right.
So it's not just a type of virus; it's a specific one and how it actually works, and then you can target it to be able to try to prevent
So
it.
all we know is that it's a virus.
Well, no, we don't know that.
We don't know that.
That's the leading theory. We actually don't know it's a virus. It could be an environmental toxin. It's possible you have to throw in there's some sort of genetic predilection to getting this as well.
Right.
It seems to happen only in kids, so what's different about maybe the immune system or the growing nervous system of young adults and children? I think there's a lot of things that are wide open, and again, that's why I say this is a little bit scary, because we have way more questions than we have answers.
Right, yeah. But as of today, 60-some-odd kids have been diagnosed?
62 in the United States this year. But there's about 600 some cases since 2014, I think.
Around the world?
Number. No, just in this country.
Oh, just in the U.S.?
The CDC's been tracking it in this country.
Wow.
So if you get on the CDC website, they can give you the table. Number of cases in 2014, 15, 16, 17, and so far in 18.
Do they have a name of it, or they just keep calling it this polio-like vaccine? Or polio-like?
They have a name for it. You can call it the polio-like illness.
All right, for now.
I mean, until we find a real cause for it and be able to give out specific information that everybody wants. Like, well, how can I avoid it?
Right.
And what can I do to prevent my kids from getting it? These are important questions, but unfortunately, we do not have answers to that.
Dr. Michael Lim, cardiologist with SSM Health, SLU Hospital, and SLU Care. You are the best. Thanks for all the insights.
Thanks.